And I'll hand over to Professor Deborah Fitzsimmons to start the session.
Okay, well, hello everyone. Hope you're safe and you're well, and thanks for coming along to this session this evening or afternoon, wherever you are in the world. So I'm going to just get slides up. There we are, and I'm going to assume that there we are. Just bear with me a minute. Okay, so sorry, my slides have come a bit odd, but anyway, I'd like to take the next half an hour or so to talk about why I think everybody needs a little bit of health economics in their lives. First of all, I'll introduce you to my team. I'm director of our research centre here at Swansea University. We're a diverse team with very different skill sets and experiences, but we all come together to ask some really important questions about how we make some very difficult choices and we prioritise our scarce resources in health and care today. We're living in very interesting, difficult and challenging times, and I'm sure that in your own countries, in your own areas, you've already seen and witnessed the sort of the accounts of how COVID-19 pandemic has affected all of our lives. This is just a very random selection of some of the headlines that we've probably all seen over the last year. And this is bringing into sharp focus why we need to think about the health and economic impacts of the COVID-19 pandemic. And I'm going to talk about this, about how health economics might help you as a researcher, as a healthcare manager, as a healthcare practitioner, or a policymaker in terms of trying to derive the evidence and make difficult decisions in an open, fair and transparent way. And why do we need to look at it? Well, let's just think about where we are in today's world, and we look about how our health and care systems and services are organised. And we have to take into account that our successes in terms of promoting better health for populations, our significant work that's happened in public health and obviously around all the various treatments that are now available, means that we have people's expectations rise. Not just the public, so we all expect to live longer, hopefully live as long as possible in a healthy life, but also that clinicians also have raised expectations. They can do more to treat their patient, they can do more to ensure that people survive or have better outcomes or quality of life. Some of the demographic transitions are also important here. We've got an increasingly Asian population, and that brings in other demands on health and care as we grapple with the complexities of people living with different and often diverse chronic conditions. We also have to look very carefully about the recruitment crisis in the health and care workforce, and this sort of spans across countries, and indeed is starting to become a more international problem as countries and systems sort of compete for scarce workforce. And so we have to take into account about how we organise our resources. And one of the most important resources that we have is our assets in terms of our health and care professionals. We have increasing high cost technologies, very costly drugs and interventions. And we also have to factor in now the impact that COVID-19 has had on what was already health and care systems under strain. And really, unless a miracle happens, we are going to have to make some very difficult choices on how we allocate our health and care resources across our healthcare systems and societies as a whole. So let's think about what some of the choices that we make. How do we make these choices? How do we do it in a fair and rational way? How do we make sure that we're taking into account the ethics of some of our decisions about who and how we allocate our scarce resources? Do we prioritise COVID-19 over cancer screening, for example? This is a very hot topic at the moment within the UK because we are seeing some of the impact of on other conditions over and above COVID-19, as some services were stopped as a result of the ongoing pandemic. Do we allocate healthcare services to the needs of the young? They've got more potential to be more economically productive in society, rather than maybe giving resources to old people as we recover from the pandemic. Or do we spend our budgets on blockbuster drugs that are going to promise a significant cure for people? Or should we spend that money more on our upstream public health interventions? All of these are current conundrums that decision makers are faced within health and care today. The issue is not how we prioritise, but how we do it best. And so health economics as a subject, as a discipline, as a set of research methods and analysis, helps us to provide the evidence to make the best possible choices to ensure we get the most value out of our scarce resources in health and care today, making sure that we achieve the best outcomes possible for our population and people. So let's go a little bit more into then, so what is health economics? So health economics, it comes from the discipline of economics. It is a lot more applied, and it's attempting to study how we allocate those limited or scarce healthcare resources amongst all the unlimited wants and needs that we have as a society to try and achieve the maximum health benefit. So it's about getting more bang for your buck in a way, using our scarce resources in the best way possible to derive the maximum value. And it takes us back into why we actually have economics around in the first place. This goes back to the concept of scarcity, which I've already sort of alluded to in my talk. And without scarcity, there'd be no need for economics, or indeed economists like myself, since we would have everything available to us and we could buy or have whatever we wanted in society. Wouldn't that be nice? However, that is probably not going to be the case, certainly in the delivery of health and care services, certainly as we move forward across the world in terms of coming out of the current pandemic. So what does health economics do? It's a way of thinking. It's a way of using some of those economic concepts and applying them to health and care dilemmas today. That's really important. It's about thinking and communicating as a health economist. It's a set of techniques. Our business is often to generate evidence. You may have heard of words such as cost effectiveness or cost benefit. These are the tools and techniques and methods that we will use to derive the best possible evidence to inform healthcare decision-making policy and practice. And one thing to just get across, it's not about being accounting. We're not the accountants. We're not the financiers. Okay, we are going to be using these economic concepts to think in a different way about how we derive the most value out of our limited resources. So, does it matter? Does it matter what resources are used in delivering a health technology service? Why do we worry about this? Well, yes, it does, because it takes us back to this concept of scarcity. And there'll never be enough resources to produce all the outputs that we want, whether they be health outcomes in terms of improving health outcomes, such as survival or quality of life for people, but also non-health outcomes, for example, where we're trying to improve the well-being or the economic productivity of people, to satisfy all those human wants and needs that we have. And so that we only exist as a discipline because of this conundrum between the resources are scarce relative to the demands that we place on them. So what does scarcity bring about? Well, it means we can't do everything we would like to do. So we have to make choices. Sometimes those choices are difficult. How do we prioritise spending on, say, a public health intervention for young people compared to investing in a drug which would prolong somebody at the end of life? So these are very difficult decisions. And so we have to be very conscious and careful that we make these in an ethical way as possible. And we do that by making sure that our choices are made on clear and transparent and evidence-based criteria, and that those should be explicit. And so the one criterion for choice which health economists use is this notion of efficiency, maximising the benefit of the available resource. And so how do you take this forward? Well, I'd like to introduce you to something called the concept of opportunity cost. And what we have to do is try and work off and trade off the sort of costs and benefits of what we do. And what we're trying to do is get to a sort of perfect place where we won't gain any more by trading off resources, something called the Pareto principle. And what we're trying to say is that when resources are limited, it is necessary to give up one thing in order to be able to acquire another thing. So for example, if you were choosing your car, what would you choose? Would you go for maybe the Ford Fiesta at the end? Or would you be looking at the nice Audi convertible in the middle? And again, some of those choices will be subjective, but they will also depend on the resource we have available, for example, our budget. And so we have to think about this notion of opportunity cost. So choices need to be made. Do we invest in a new TV? Or do we invest in a nice holiday? Or do we invest in our gym subscription? Again, we make choices and we balance those opportunity costs ourselves in our normal daily lives. Same thing applies when we think about this in terms of health economics and trying to look at the best way to use our resources within health and care. And so those principles applied. We have the same needs, wants and desires. We've got this aging population, decrease in health. And for example, looking at the NHS here in the UK, which is a public healthcare system, our resources are ever decreasing. We've got issues around our staffing levels, we've got changes in our NHS budgets, and we're increasingly seeing more expensive technologies and care coming out to play. So let's look at this notion of opportunity cost then in relation to how we deliver health and care today. So each healthcare intervention has a cost. And we don't talk about costs in terms of its financial sense per se, but in terms of resources. And so if we spend our resources on one intervention and we've got a limited budget, it means we cannot invest in others. And so we have to make these choices about what we spend our scarce resources in, this opportunity cost. And let's have a look at this in a bit more sort of visual detail. So for example, if we're trying to look at the opportunity cost of in vitro fertilization, so this would be a treatment that would be offered to people who were having difficulty conceiving. Now, we would know the sort of resources that would be used in that, and we have to think about, well, what else could that resource be used for? Well, in the NHS, it could be to support providing a cochlear implant to a child. It could be to undertake a heart bypass operation in somebody with in middle age with cardiovascular disease. It could be used to provide cataract removals in 11 older people. Or we could use it to inform public health campaign to promote vaccinations, and we've used the MMR vaccine here as an example. Here, so we have to think about how do we trade off the resources that we would need to invest in the IVF against some of the healthcare resources that we could possibly use, looking at that investment conundrum. But we also need to think about this outside the NHS. We have a public sector budget. What else could we use those resources for? Well, it could be to help education. We could fund, say, half the junior teaching assistant, or we could provide 3 school meals to a whole secondary school. Okay, so this is just examples of the ways that we have to make difficult choices about how we use our resources most wisely to get the maximum benefit. And of course, choice does have this element of subjectivity. We do it in our everyday lives, and often that's done in the moment. But we cannot use those principles in making difficult decisions about how to allocate resources within health and social care. We need to make these objective choices, and that's why we need to think about it in terms of efficiency, but also in terms of equity and equality. So what is efficiency? And I'd just like to bring up the words of Alan Williams, who was one of the sort of founding health economists here in the UK. And even though that this quote is coming up to nearly 30 years old, it still rings true today in terms of what we're trying to do in terms of making these difficult choices. And it's in a system with limited resources, health professionals have a duty to establish not only are they doing good, but they are doing more good than anything else that could be done within the same resources. And I think this signifies the sort of moral and ethical responsibility that we have when we're in the business of delivering healthcare, to remember the words of Alan Williams here. So what does this mean in daily practice? Well, increasing demand, decreasing budgets, limited and stretched resources, and clearly the COVID-19 pandemic has put in strain on our healthcare systems. We have to think about those ethical obligations, because every time we're providing a service or intervention that is not good value for money, we are wasting resources that could produce more benefit elsewhere. So it's not just a question about whether we should invest in services that work, but also to make sure that we're not wasting resources which are not working or are not effective. So it's our responsibility and moral obligation, whether we're in the, wherever our role is in the business of delivering health and care, to provide the best quality and best value services so that we maximise the utility for the population. And the health economic solution is that the most efficient one is the one that makes the best use of our resources available. And so that's where health economics comes into healthcare research, policy and practice. We work multidisciplinarily. We work with healthcare practitioners, we work with healthcare decision makers, and we also undertake and support a number of research studies that aim to work out the cost effectiveness or cost benefits of our interventions and services. It's a very varied role. And so what we need to do as economists, and this is where we would be looking at supporting some of the healthcare programs that the faculty delivers, is developing not only those critical thinking skills, but also so that you can apply these principles of health economics to inform health and care decisions. And that's about maximising the benefit of our available resources to enhance population health, to understand and to make explicit how we meet this sort of this difficult conundrum between meeting all our wants and needs, whilst also promoting and protecting health and preventing ill health and disability. Really crucially is taking us to this notion of obtaining maximum value for money by ensuring that not only we're talking about the clinical effectiveness. Of course, we want to deliver interventions and services that make a difference to people, that are safe, that give a patient or users of services the best experience, the best quality, but also that we take into this notion of efficiency and look at the cost effectiveness of the healthcare provision that we're providing. And again, making sure that we avoid harm. And we health economists would look at harm as investing and wasting resources when we could do much better in investing those resources elsewhere to maximise health. And so what we do is that we'll introduce you to those thinkings. We'll also introduce you to some of those methods, and we're able to draw on our extensive sort of real world research experience to ensure that we bring research led and just focused teaching it into our sessions and modules that you may want to consider taking part in if you join us here at Swansea University. And this is a basic diagram of a cost effectiveness, and simply what we're trying to do is look at the cost of programme A, look at the cost of programme B, okay, and then compare the outcomes. So it's a comparative analysis And in order to do that, then we draw on different research methods, study designs, and quantitative analysis. We also, as health economists, do some qualitative analysis as well. So please don't be put off by the word quantitative analysis. There's a place for everyone in the world of health economics today. So how will we support you here at Swansea? Well, my team teach across a number of postgraduate modules, and we lead specific module health economics and research and evaluation here within the faculty. We draw on our wide experiences, our contribution to research. For example, I work on national policy making committees on medicines and technologies here in Wales, and we will use that to give you real world examples to help you develop that health economics thinking and application. We also help you in terms of your own research study. We offer an MSc by research, MPhil and PhD opportunities. And just a little hint, well, watch this space. We are in the early stages of developing our own health economics here at Swansea University. So I think hopefully I've given you a sort of flavour of what health economics is about. How it can help you. And I think the message I like to leave is that, can you not afford not to have health economics in your life? Thank you.
Thank you. As I said, if anybody has any questions, chance to put them into the Q&A box or the chat box, and we'll be able to answer them for you. So there was one we came in to me earlier, so I'll ask that one first. Which MSCs are you teaching sort of health economics across before the MSc in health economics is being developed? Where are the modules in health economics, I think?
Okay, so all right. So my understanding, they are in the healthcare management programs. We run an optional module there, but we sprinkle ourselves quite subtly across that that program in terms of some of the policy modules, and we also contribute to the research. We also support the Masters in Public Health and Health Promotion. Again, one of my colleagues takes a sort of real world focus there, and we support and lead the research and evaluate module in there. I suspect there'll be more potential to develop other options as we're looking at extending that at the moment. But there are two core programs at that currently.
I can see Thomas has raised his hand. If you unmute Thomas, you can ask a question. Unmuting yourself, and we should be able to hear you.
Oh yeah,
if not,
good to hear somebody.
if you want to type your question into the question and answer box, we can answer it as well.